We are coming with a lot of energy, with a lot of vigor, and with your support and cooperation, I think Lamu has a huge potential to both economic and social prosperity.
Hello and welcome to the Sound Mind podcast where bold voices meet real conversation. My name is Nancy Weshira and I'm so glad to be here today now that I am joined with one of the guests that I've really wanted to host for the longest time. Today we have our guest being the Deputy Governor Lamu County, and without further ado, let me just give him a chance to introduce himself. Karibu sana mheshimiwa.
Thank you very much, Nancy, and welcome to the office of the Deputy Governor.
Asante.
My name is Dr. Mbarak Mohammed Salim Bahjaj. I am the current Deputy Governor of Lamu County and also the County Executive Committee member or County Minister for Health Services. I have been serving under the capacity as CECM for over 3 years now, and the leadership of Governor Issa Timami. About 3 months ago, I was appointed the Deputy Governor following the demise of the late His Excellency Rafael Muñoz. May the Lord rest his soul in peace. I am a medical doctor by profession. I have over 13 years cumulative of both clinical and health administrative experience. I have worked in several levels, all levels of healthcare, both in the private sector and the public sector. I am very passionate about healthcare reforms, and this is one aspect that drove me to move from the private sector to the public sector, so that I may come here and make a difference in the health sector of Lamu County. I hold a master's degree in public health management, an undergraduate degree in medicine and surgery, and before that I was a clinical officer with a diploma in clinical medicine and surgery, and I am currently pursuing my second master's degree in health systems management and development with AMREF International University.
Thank you so much, Mheshimiwa. We all know you as the Deputy Governor. I would please like to know your life before being the Deputy Governor, like where you grew up, where you schooled, and how you reached to where you are now.
Yeah, thank you. So I was born in Mombasa in the year 1981. That makes me 44 years of age. However, I was brought to Lamu by my parents at the age of 6 months, where I was then brought up by my grandmother here in Lamu. This is where I got my basic religious education at Riadha. And then I did my primary school education at Lamu Primary School, now called Mahmoud bin Fadil. I went on to Lamu Boys Secondary School, and I finished in the year 1998. And then I proceeded to, Kenya Medical Training College. Yeah.
That is the KMTC.
Yes.
Oh, you schooled in KMTC.
Yes, I studied in KMTC, Port Reitz, Mombasa.
Yes.
Where I did the diploma in clinical medicine.
Yes.
So I became a clinical officer. I worked for 5 years.
Okay.
And then I went back to university and did my undergraduate degree at Egerton University, Nakuru.
That's amazing. Okay, so let us start it from here. How did you become the Minister of Health? Were you a doctor, or you just met yourself as a Minister of Health in Lamu County?
So I was working as a doctor immediately before coming to Lamu. I worked at the Coast General Hospital, Mombasa, as a doctor and as a medical superintendent at one of the satellite of Coast General at Mtongwe. So I had worked there for about 1.5 years prior to coming here. And before that, I worked at Kenya Red Cross Hindi Rehabilitation Facility. And before that, I worked here in Lamu for a few months as a medical doctor. Before that, I worked at Mombasa Hospital in Mombasa as a physician associate and head of a dialysis unit at Mombasa. That has been basically my career, and I met Governor Timami, or we got to know each other through a program that I was doing here in Lamu. And that was Afya Majumbani, what I used to do as a part-time or as voluntary work outside my work hours, or over the weekends. I used to visit people who were bedridden in their houses, especially in the far-flung villages, Lamu East, Lamu Central, Lamu West. So I used to visit them, the paralyzed patients who have suffered stroke, the elderly. So I used to go and offer them free medical services, checkups, medications, counseling. So I got to know Governor Timami through that, and when he won the election, somehow he found it within his own wisdom to call me and come work with him as his, county minister.
So you've mentioned about you being a volunteer. Were you like doing it alone, or maybe someone was sponsoring you to do that?
So what I used to do,
Yes.
I had, other doctors, my friends. So I would raise some funds or ask them to donate drugs.
Yes.
And they were supportive. I had a few other non-medic friends who also supported the program.
Yes.
So it wasn't that expensive. Medication worth 5,000, I would serve maybe 10 households. So I did that on a small scale, and then I got Governor Timami to support me with his boat.
Okay.
So then I could expand my wings and go far to the islands to offer the same. So it was just a personal initiative, my own salary, and a few of my friends supporting here and there, and we made it happen.
That's amazing.
Yeah.
I never knew about that before.
Yeah.
So in that initiative, are you still doing it, or maybe you just quit when you got to be the
No,
LC?
so when I took over the department, I made it a departmental program. I identified doctors, we call them sub-county medical officers of health. So we identified 3 of them, one at Lamu East, Lamu Central, and Lamu West. So these ones will work with other junior doctors and, implement that program. We did that program for 1 year. Unfortunately, Lamu was faced with recurrent, persistent power outages at some point. That issue interrupted that program, because then we had to divert all our fuel to our hospital generators. So that program, we suspended it for 1 year because of that challenge. But in this year's budget, it is, again, we've slotted it as part of our recurrent expenditure, and we are going to revive it. And those doctors work closely with the community health promoters to identify households with patients who cannot, reach the hospitals. The cancer patients, very elderly, those who have had stroke. So our doctors visit. We have done over 168 visits with our doctors, outreaches. So each outreach, maybe a doctor will visit 20 to 30 houses. So that's quite a lot of home visits for doctors.
Sure.
And it is a program that we are really, really proud of. And we hope to, resume it very soon. And one other thing under that program, when I came in, I found the Beyond Zero lorry. You know the Beyond Zero lorry that was launched sometimes back during President Uhuru's regime.
The Margaret Kenyatta's initiative.
Exactly. So those lorries somehow, were grounded. So when I came in, I found that lorry had been grounded for over 3 years before. And so we did a bit of refurbishment, and we revived that lorry, and we used it to do even more outreaches. That lorry alone, in the year 2023, did over 60 outreaches in far-flung areas of, the mainland. So again, that will be revived this financial year. Hopefully, 1 month from now, after the supplementary budget has been passed, we should be able to. It is a program that I am personally very passionate about, and I credit it for my appointment as the county minister, because that's where I got to know the governor.
Wow, amazing. So is it that you love doing charity work?
For me, medicine is generally a calling. It's not, really work, just work, purely work. Okay, it is a profession and, things that we do on day to day, but it is largely a calling.
Okay.
And I always like to instill that in my colleagues. And I'm glad that a number of doctors and nurses and clinical officers have taken it up, and they have that spirit of volunteering, even as you are doing your work as required to.
As a Minister of Health, tell us about the achievements that you have had so far and changes that you've made in health department that you're proud of, and that you can say that even though, like, when I leave this department, this is a legacy that I will leave as a person.
I have managed to complete and operationalize over 40 projects under the Department of Health since I took over. I don't think any other CECM in the country can boast that. And I challenge, I know it's not a competition, but that tells you about my mission in Lamu. I came to Lamu with a mission, and I'm glad that, we are achieving it despite the challenges in terms of resource, limitations. But I might mention, a few legacy projects that we've managed to, accomplish. For the Lamu County Referral Hospital, one of the things that stand out is one new additional theater, operating theater, that we have, operationalized. This is a theater that was constructed during Governor Timami's first regime. It was abandoned. It was made to be a storage facility. And when we came in, we equipped it with state-of-the-art equipment. That theater is now able to do what you call minimally invasive surgery. This is surgery without opening up people. They use, small holes. It is able to do urological surgeries, for prostate diseases, bladder diseases, kidney stones, using laser technology. We are now able to do endoscopy. That's a camera that you put inside the mouth to look at the upper digestive system. Colonoscopy for the other side of the intestines, to look for diseases, diagnose and treat at very early stage. And we have recently introduced what you call laparoscopic surgeries. So they're able to do abdominal surgeries without opening up the patient. That helps with quicker, faster recovery time. And these are technologies that the private sectors in Mombasa and Nairobi are now adopting, such technologies. So we've been able to do that here at very, very affordable rates, rates that are usually covered by SHIF, for those who are members. Apart from that, one other project that I'm really proud of, and is a project that I tried for 2 years to implement, is the oxygen plant at the Lamu County Referral Hospital. And I would like our people to understand the difference between oxygen plants. The oxygen plant at King Fahd Hospital is one that has produces oxygen of purity of the level of 93% and above. There are other oxygen plants and concentrators that usually give you 65 to 80%. So those are not the types of oxygen you can use for intensive care units, like the ICU. So ours produces pure oxygen, and we imported that plant from Slovakia. It is a state-of-the-art plant, and that has helped us, cut down our demands for, refilling oxygen in Mombasa. Initially, we used to take 30 cylinders to Mombasa. They get refilled We bring them back, they are used. Then you take them back again. It used to be quite a headache, and I remember once the roads were cut off here, about 1.5 years ago, because of the floods.
Yes.
And it was a really, really big headache for us, for our patients to get oxygen. We had to ask the Navy to intervene, and so now we are producing our own oxygen, both for the ICU, for the hospital, and even the other facilities we are able to supply.
Yes.
The other project that I'm proud of is the intensive care unit. For the first time, Lamu County, since independence, since ever, now we have a 6-bed ICU, which includes 4 for adults and 2 for babies. So that's for us, that's quite something. 80% of our referrals to Mombasa used to be because of ICU needs. So now we've cut down that. There are still a few cases of intensive care that need super specialized services that we still refer, but it is one, maybe it may happen 1 in 3 months, but largely we are able to manage those here. The other project that I'm proud of is Mokoe. Mokoe was ruins. Mokoe was built before King Fahd was built by the Saudi government.
Hospital.
Yes. It was built in the 1970s, and then it was abandoned. So there are a lot of ruins there. We've managed to convert them into maternity, into proper wards for male, female children. We have a theater that is specialized for orthopedics, bone surgeries. And we've now opened a special unit for eye care, a comprehensive eye center, where even glasses, patients are able to get glasses, refractory glasses, right here, unlike before when people had to travel all the way.
Amazing.
Yeah, we are probably the only county that has 2 dialysis units in 2 public hospitals. Most counties have 1, and then you have the private sector. For us, we have 1 at King Fahd, we have 1 at Mpeketoni Hospital. So initially, when the King Fahd unit broke down, patients had to go all the way to Malindi twice a week. That used to be a horrible experience for our patients. But now we have a twin dialysis unit. It has relieved pressure for the King Fahd plant, and also it is a form of backup.
Wow.
So if I start to mention one by one, we can stay here until I've done 40 of these projects. But those are the ones that probably stand out.
Most.
And I've been telling people this is only 40% of what we can do in the health sector. We still have a long, long way to go. Health sector is a diverse field, growing every day, expanding every day. You cannot transform the whole health sector in 3 years. It still needs time, still needs passion, still needs investments. But I believe in the next 7 to 10 years, I think Lamu will be a hub for medical services.
Citizen will always criticize departments, especially when services are delayed. I've seen people complaining about lack of medicine in the hospital, poor services. And then how do you take such critics and how do you ensure that changes are made to match the people's demand?
That is true. Unfortunately, the public sector, as I've told you, in the whole country, not just Lamu, there is a lot of work to be done for the public sector, unlike the private sector. And that is because of 2 reasons. One, the public sector in general in Kenya is underfunded. We are proud of devolution. However, we still have a problem that the biggest chunk of resources is retained at the national level. You find the Ministry of Health being given over 100 billion to run the health sector, whereas as counties, maybe the largest gets around 2 billion. For us, the whole health sector, we run with a budget, including salaries and everything, of about 2 billion. So underfunding is a big problem for the health sector. Health sector is very expensive. Health services are very expensive. Maintaining is very expensive. We have one equipment called the laser that we use it to, do these kidney stone surgeries. Recently, because of power instability, I lost some gadgets. So to replace that, I needed 1.6 million. And it was not even available in Kenya. We had to import it from India. So that's just one of the equipment. And hospitals are, facilities that there is a lot of wear and tear of equipment. There is a lot of human resource demands. So the resource needs of health sector are very big, are huge, and the supply is very low. So you'll always be chasing. I'll give you an example. Lamu County, an assessment was done by the Ministry of Health, supported by the European Union, to assess the needs for medication, drugs. You see this issue of madawa hakuna. So they gave us a report that said, for you to meet your needs for drugs, you need a budget of about 360 million. So currently our allocation for drugs is about 100 million. So that tells you we have a gap of about 260 million. And that excludes the ICU. For ICU alone, you need about 60 million to run an ICU, just in terms of drugs. They are very expensive. What have we done? What we've done is a legislative reform. In 2023, we enacted a law called Lamu County Facility Improvement Financing Act. So initially, before, when a hospital generated any revenue, either from NHIF or from people paying cash, that revenue had to be taken back to the government through the CRF or other mechanisms. The hospital had no permission to use those funds. Even if you don't have medicine, you have nothing, it will go back to the government, and then you'll wait for it at the end of the year during budgeting process. So we changed that law to make sure that in Lamu, any hospital that generates revenue, that revenue is retained at that facility. And they're able to use it every 3 months instead of waiting, once a year. So that has helped because now if, for example, King Fahd is paid, say, 10 million by SHA, that 10 million is retained by King Fahd. Then at the end of the quarter, the hospital management and the hospital board, they sit down and budget for that 10 million. So we'll say, out of this, we have a deficit of drugs, 3 million. So allocate 3 million for drugs. We are short-staffed in terms of, maybe cleaners or security or any other support services. They are allowed to employ, casuals to add. There is a machine that has broken down, like the one I've told you, the laser. The hospital has been able to repair that machine on its own. Had it been 4 or 5 years ago, they would have had to wait for the budget and then wait for all the processes and then repair. So at the moment, the money is still not enough to cater for all needs, but every time they offer services, the hospital is paid, that money is churned back into the hospital to improve services. When we started, the budget for drugs for King Fahd for the whole year was around 12 million. Through FIF, now King Fahd is able to buy drugs worth 30 million in a year. So it has almost doubled. But it's still not enough. King Fahd, 30 million for drugs is not enough. They need 60 million for drugs. So it will take a bit of time for them to cover that gap. The same applies for all the hospitals, including dispensaries. Dispensaries are free for wananchi. They just need to register for SHA. Once you register, that dispensary gets money on your behalf. So for example, Kiunga dispensary is called health center, but it's still a dispensary in my eyes. They were paid around 8 million by SHA in the previous financial year ending 30th June. So with that kind of money, if it were 5 years ago, they will have to return that money to the government. But now the money was retained. They were able to buy 2 machines, one for full hemogram, one for kidney and liver function test. They were able to increase their budget for drugs from 300,000 to 900,000. So this kind of setup, eventually, it will strengthen the health system. but it is not possible for you to cover that gap in 1 or 2 years. It will take a bit of time, but I think we've really tried with this FIF thing.
Yes.
There's still gaps. Sometimes SHA delays in paying us. Sometimes instead of paying 10 million, they will pay you 50,000, and you still have a gap like what is happening now.
Yes.
But eventually, once things are streamlined, it will be okay.
I've heard you talk about SHA, and I've seen Kenyans online complaining about SHA not working.
Yeah.
Is it working in Lamu County?
Yeah, so SHA has its strengths and
Yes.
it has its weaknesses.
Okay.
We must be frank.
Yes.
And I'm not just saying this to you.
Yes.
I've said this even to the principal secretaries.
Yes.
That SHA has its strengths, and we are glad, but it still has some gaps. SHA for level 2s, as I've explained,
Yes.
just by virtue of somebody registering for SHA,
Yes.
dispensaries have been getting money, and that money is helping to strengthen the service at the dispensary level. For level 4s, in Fad, Mokoe, Witu, Faza, Mpeketoni,
Yes.
somebody has to be a chief member. You have to pay the subscription. You register, then it tells you owe SHA maybe 6,000 for the year, or 7,000, or 10, as such, depending on the means testing tool. So you have to pay that premium for you to get services at level 4 hospitals. However, for inpatient services, for surgeries,
Yes.
SHA covers almost 100%. We've had claims here. Somebody has come, they've done major surgery like the laser surgeries, which usually will cost around 150,000. We do a pre-authorization, SHA approves 100%.
Okay.
Somebody has done an operation and they go home, they don't pay a single cent.
Okay.
But when it comes to outpatient services, the allocation is still very low.
Okay.
Per person, they allocate 75 shillings per visit. That's almost negligible.
Okay.
What are you going to use 75 shillings for? Are you going to send that person to that's not even consultation and the book, and it's done. So that's why you find people being asked to top up for the outpatient services.
Okay.
I hope there'll be more allocation by the government to SHA so that they're able to cover the outpatient service. But for inpatient and surgeries, I think it is doing tremendous. But as far as that one is concerned, that is the problem. 2, the delayed disbursements of claims. I'll give you an example. Last quarter, Mpeketoni was owed 12 million by SHA. They paid the hospital 30,000 shillings. So you've used drugs and consumables worth 12 million, and then you are paid 30,000 instead. How are you going to use 30,000 to recover the items you used worth 12 million? King Fahd is owed 22 million. They were paid 1.2 million. How do you recover that balance? So once these things are sorted, I think SHA will be the best health scheme that Kenyans have ever experienced.
Wow. And I've seen people complaining about going to the King Fahd hospital and then they're asked to buy a book from the hospital and they're saying that it's not something that was there before. Is that true? Have you heard of that?
Yes. You go to King Fahd and the doctor scribbles a few things there.
Yes.
Then you go home, they use it to wrap bajia and stuff.
Yes.
They throw it away. The next time they come, the doctor doesn't have the previous reports.
Yeah.
Medical, healthcare is a continuum. It's not a one-off thing. The books that we provide is a book that maybe you can use even for 5 years. And you are buying it for 100 shillings. But it is your own health record. You take it to the house, this is my book for the hospital. The doctor wants to refer things that were done onto you 1 year ago. If you are diabetic or hypertensive, we need to follow. You started with amlodipine, it was not working. You were taken to Losat H, it's not working. Maybe it worked for a while. So the next doctor to see you needs to know that 1 year ago you were given amlodipine and it did not work, so that they don't end up giving you the same thing. So this all for the best. However, we are now moving to paperless technology. So very soon, for the level 4 hospitals, patients will go there and there will be no paper, there will be no book. So it should not be a big deal. We shall be using the health management information system, the networked, health system, so that the patient just moves and the doctor and the lab and the pharmacy, they're able to communicate through an intricate, computerized information technology system.
Okay. Thank you so much. Nurses have been on strike for days. People would like to know what caused the strike and how the agreement was reached. Being in your department, I'd like you to elaborate about what happened and what was the agreement.
Yeah, so it's true. There has been an ongoing nurses strike. It's nurses strike, not the whole, all the cadres. It was just nurses.
Yes.
And there has been some areas of contention.
Yes.
The top three, one is about promotions. And these promotions are problems that have stagnated from 2014.
Yes.
They are not promotions that we have denied, from 2022.
Yes.
So, and promotions have budgetary implications.
Yes.
The biggest challenge we face as a county is that our location is not the same as Mombasa, the same as Nakuru or the other. We received the list. We received 3.2 billion, and we use 2 billion for salaries and fuel, and we have very little money for development.
Yes.
And that's why you see us moving around like headless chicken, looking for donors and partners and all manner of professional begging.
Okay.
Is because our resources are scanty. Okay. So for you to implement promotions for a number of staff, you need to factor that into your recurrent expenditure. Our recurrent expenditure is currently at 41%. From the Public Finance Management Act, PFM Act, the maximum allowable limit is 35%. So every time you add a budget with promotion, or you are adding more trips to travel and everything, it is adding on to the 41%. So we have a problem with, compliance to the law. However, we have really tried. Last year, we managed to promote about 50 staff.
Yes.
And we started with the ones that had lagged the most. You can start promoting people from 2020, leaving the ones 2014. So we started from backwards coming forward. This year, we had planned to promote about 100.
Yes.
And we were in talks with the union. And there's one thing that pissed me off, because we were in talks. We had about 3 meetings before the strike. And we did explain the situation that, for us to implement those 100 promotions, we need the systems to be working. We need to do proper procurement, everything, updating. Until now, we have not used a single cent from our budget because of the new system of procurement called EGP. So somehow people lost patience and they decided to go on strike. The other issue was there was a strike in 2021.
Yes.
And people went on strike for 3 months. The then government withheld their salaries for 3 months, and that money disappeared somehow.
Okay.
So now they've come back and asked to be paid for those 3 months. The budget for that is about 27.6 million. So I told them, look, don't just find 27.6 million and pay, there is a process involved. I need to find that money. For Lamu County, 27 million is a lot of money.
Sure.
So I had promised, we start to look into that, maybe pay 30% next financial year, 2026, then maybe another 30% out of goodwill. There is still a court case going on about that has not been concluded. But we thought maybe we'll offer that so that the case is withdrawn and we settle it amicably.
Wow.
So people do not want to, consider that. And the other issues, there were non-issues really. And I think they were sort of the main ones are those ones. So there have been talks going on. sorry, there was something about the uniform allowance, about 25,000 per nurse per year. And then there was something about risk allowance. So we had agreed to pay some of this, because the budget was not much. And there are things you pay once a year, like the uniform allowance. But somehow they were pushing that we implement everything at once, so it was not possible. And we've been very considerate. We've allowed people to be on strike and stay at home, and we've paid them for 2 months.
True.
This month we withheld salaries for those who did not report to work. So you also have to,
So that's how you got into the agreement.
Yes. So I think there was a meeting today, and I believe there'll be something, coming out of it. However, you must understand,
Yes.
For all these 2 months that people have been on strike, there has been no patient that has been returned home without services.
Okay.
We did our own, creative, innovative ways of making sure that services continue.
Okay.
We use the contract staff.
Yes.
We use the UHC staff, and we paid locums.
Okay.
So same nurses who are on strike, you pay them, they come back and they work for you. So we used that and made sure that services were not interrupted. You did not hear of a death that occurred because there was no, staff to take care of somebody. Unlike other counties that were grounded, fully or totally.
Okay.
As we tried. And I've told them, these are the terms. If you want to continue with your strike, you can continue until 2030. Services will continue. I assure you, the people of Lamu will not suffer.
Okay.
Because you need to have give and take in this negotiation. It's not like I don't want people to be promoted. I want everybody to be promoted, because that also gives me political mileage. But then if the resources are not there, what can I do?
You can't do anything.
Yeah. So
we've talked much about health department, and with health we can talk like a whole day.
Absolutely.
As the deputy governor, you are the leader. Young people are complaining about lack of job opportunities, and the government does not care about creating the opportunities. Sometimes opportunities are said to be given to the people who are not from the local. What's your comment on that?
Yeah, so it's true. Employment opportunities are scanty.
Yes.
And partly the reason I've told you is our wage bill. We are at 41%. It's not like there is no need. There is a lot of need. I need 60 nurses for me to make sure that every dispensary has at least 3 nurses.
Yes.
Currently, I have 10 dispensaries with 1 nurse.
Okay.
She becomes sick, the thing is closed. She goes on leave, I have a problem getting replacement. So it's not like the need is not there. We need enforcement officers, more of them. We need more cleaners. But the budgetary constraints and the wage bill issue is a real, big thorn in the flesh for us. However, I want to particularly point or single out His Excellency Governor Timami's efforts in terms of attracting investors to Lamu to set up all these, there is a fruit processing plant coming up, there is a cotton ginnery coming up, there is a coconut processing, cashew nut processing plant, sunflower processing plant coming up. There are investors interested now in investing, towards the LAPSET project. There are investors coming in, targeting exports and stuff. So all these efforts are to make sure that there are other opportunities outside the county government that His Excellency Governor Timami is trying to set up.
Yes.
And the biggest beneficiary of this will be the local, Lamu youth.
Okay.
And a bit of patience. I'm sure this will come to fruition. However, always, whenever we have other projects, donor funded, all these other national government projects, we try as much as possible to involve the youth and the women groups, so that they benefit here and there. There are still ideas that are in the pipeline. We hope to, for example, increase the scope of tourism. in Lamu, so that we can create more opportunities, for these youths. There are opportunities in the blue economy. There are opportunities in agriculture, and very soon, the youth of Lamu will have something to hold on to and to be proud of.
Wow. This is about you. Taking the deputy governorship is a big shift. What excites you the most about the new role, and what worries you?
Yeah, what excites me is this once in a lifetime opportunity, and
Yes.
I'll get to say that in the history of Lamu, I once became a deputy governor, and I was able to push or put in place 1, 2, 3 interventions, through this position that made a difference for the people of Lamu, be it in healthcare, be it in water, be it in education. Now the horizon has expanded, and not just limited to health. And those are some of the areas that I'm passionate about: education, provision of clean water, and tourism, etc. What worries me most is I have very little time, and I might do things that might not be remembered. I don't want to be like, all due respect to all my predecessors, but put someone on the stand and ask them, what did the first or second deputy governor of Lamu achieve that stands out? And I'm sure they will struggle. I don't want to be like that. I want to be remembered
You want to
for something that when you ask someone about Lamu, that's the thing they remember, that there was a deputy governor who achieved this, kind of projects. Yeah.
Wow. Amazing. And now that you've achieved quite a lot as a deputy governor and in the health sector, what's next for you in your leadership journey as far as 2027 politics are concerned?
Okay, everybody is asking about that. And, as I told you, my biggest worry now is what am I going to achieve in these 2 years before 2027 for the people of Lamu. That is what is giving me sleepless nights. I know for sure the people of Lamu, if they feel that they need me as their leader, then it will be upon them to decide that they will want me to continue in whichever capacity they feel suits me. I am always in consultation. I am a man who is 70% of the times with the wananchi, nasema tuko ground, and only 30% in the office. I know how to read moods. I listen, and when the people decide, they will talk and they will say the direction we should take, and we shall be much obliged.
Thank you. And then Lamu is ranked as a county that might possibly enter into tribal politics coming 2027. Did you see that? So if it's something that's there, what is your take on tribal politics?
Yeah, it's one of the unfortunate poisons that we are faced with as the current generation.
Yes.
And particularly for Lamu, it's quite a sad state. And I must say, I think I should be remembered for that one as part of my achievements. I have really tried in the few months I've been in office to, put a plug on to that, tap of continuous venom that has been going on. Please notice in the last 2 months, there has been no talk of,
the incitement in
yes,
Facebook,
that has been there for quite a while. These concepts of Sisi Wabajuni, Sisi Wanati against the other tribes. I've tried to approach all those stakeholders involved, and I've declared my position on that, that I do not subscribe to such kind of politics or language or narratives. And whoever wants to be my friend, whoever wants to be close to me, please come to me with ideas of how are we going to make a difference to the people of Lamu. You come to me and you start to talk about tribes, I tell you bye-bye. I am not interested. Because that's not how I was brought up, or I'm a doctor by profession. I see a human being first, and I consider all the others. Just like you can be single, married, divorced, male, female. You can also be a Kikuyu or an Arab or a Swahili or a Bajun. Those are what you call demographic features. We should not forget the human being and focus on the demographic features.
Wow.
Yeah.
That's amazing. I know that you've said you schooled in KNTC, and we have one branch here in Lamu. Are you working towards making it successful in Lamu? What's are the effort that you have towards making it help the people from Lamu?
Absolutely. We have an MOU that was signed about 1 year ago with Kenya Medical Training College and ourselves, led by His Excellency Governor Timami. And in that MOU, it was about how to, revamp and expand this campus here. And I am glad that since then, they have been able to add the number of courses. Initially, they were just offering health records, but now they are offering both certificate and diploma in nursing. And very soon, they are going to start, diploma in clinical medicine and orthopedics and trauma. And that has been easy because, one, we were very willing to second our staff to that campus. Some of the staff working there are our staff, and we are also, cooperating or collaborating in terms of offering them the facilities. They are using Mokoe Hospital, they are using King Fahd and Peketoni as areas of practical attachment. Myself, I'm very passionate about the KMTC model because I passed through KMTC, and I understand, the role that those mid-level courses do. And I hope that we shall continue with that collaboration, and this campus will grow, day by day. And apart from the health sector aspects, universities and colleges are the nexus of economic growth of various areas. So if this college grows, then Mokoe will grow.
Sure.
Both in terms of population and, the economic opportunities that come together with that. So it is something that is very dear to us.
Okay. That's amazing. Something else you'd love to tell people of Lamu that maybe we left out?
I think we've covered quite a lot. I want the people of Lamu to know that we are here to serve you. We are all about servant leadership. This is not about power or positions. Let us make maximum use of these 2 years before 2027. We want to make sure that we improve on our service deliveries. We improve on all gaps in various areas, be it health, be it education, be it water, be it agriculture, and all other sectors that we can be able to make sure that our people have benefited the maximum. So brace yourselves. We are coming with a lot of energy, with a lot of vigor, and with your support and cooperation, I think Lamu has a huge potential to both economic and social prosperity. Thank you very much.
Thank you. Before we finish, Mheshimiwa, we normally have a quick fire session with the podcast. Are you ready for it?
Yeah.
So, the first question, are you a morning person or a night owl?
A night owl.
Your favorite meal in Lamu?
Pilau.
The best place to relax in Lamu?
The beach, Shela Beach.
Books or movies?
Sorry?
Books or movies?
Movies.
Wow. A song that that always lifts your moods when you're down?
this song by Chaka Khan, what is it called? I've forgotten the name. Chaka
Tumbie tu
Khan.
kama
No?
ile ya baba.
Nitakuimbia.
Okay. What's one thing people don't know about you?
One thing people don't know about me.
Yes.
Sasa nikisema naweza leta balaa.
You want them to remain not knowing.
Yeah.
Okay. Your travel dream destination, somewhere
Italy.
you'd like to go?
Italy.
Italy.
Florence, Italy.
Okay. What's the best advice you've ever received from someone?
Always be kind.
A Kenyan leader that you admire the most?
I'm a fan of Musalia Mudavadi. Yeah.
And finally, describe Lamu in 3 words.
Beautiful, serene, peaceful.
Okay, thank you so much, Mheshimiwa.
So,
It was glad having you here. Thank you for creating time for us.